we are joined by none other than the prestigious Johns Hopkins University's professor. It's none other than Amita Gupta. Welcome to the show. All this was happening in Pune?
This was happening in Pune. It was the first HIV clinical trial that was done in India for
What
HIV.
was the result of that trial?
And the result of that trial was published in Lancet, and it changed the WHO and Indian government policy.
How do you look at the COVID versus HIV?
We still don't have a vaccine for HIV, but we very rapidly developed a vaccine for COVID. India developed a cheap vaccine, which not only was much more affordable for its population, but it also exported over 1 billion doses to the rest of the world.
There were also attempts to sort of prove the fact that Pfizer was much more doable than the other vaccines.
It's not just Pfizer, with Moderna is the other company. Both of those produced an mRNA vaccine for the first time for the entire world.
Pfizer paid or spent $1 million to in the media market to ensure that things were in their favor.
Since 2014, tuberculosis was the #1 killer in the world. When I was working in India with pregnant women with HIV, I realized that they were becoming sick with tuberculosis.
What's in a particular research that you think will be breakthrough from JHU, from your department, that you're investing a lot of money on at the moment?
Yeah, so we're investing a lot on tuberculosis in a big way. We're also working on hepatitis.
As I bring you more and more tales, the feisty tales of the Indian diaspora from the United States, of those people who have not just brought a sense of pride for our own country, but for the country where they settle in now. We are joined by none other than the prestigious Johns Hopkins University's professor and director of the Infectious Diseases Department. It's none other than Amita Gupta. Welcome to the show, Ms. Gupta. It's been actually privilege having you today in this area of Baltimore. What a wonderful settings we have today. Behind me, the wharf and the still waters, which actually look very pleasant, the settings today. Many congratulations to you for the enormous feat that you have had in this country over the last 30 years or so. But considering the fact, the amount of pedigree that you bring in this country, with the education and with the qualification and also the amount of research, that's something brings me to you. I want to understand from you how satisfied you feel today for what you have done for India and the US.
Well, thank you, Rohanji, for starting off with a bit of a wonderful question. It's interesting. I look back on my journey, and I came upon HIV when I was in college. So in college, I was there from 1987 to 1991. And if you remember, HIV was discovered and named in 1983.
Correct.
So 4 years into the epidemic, as we understood it back in those days. And someone in my dorm actually was diagnosed with HIV. And unfortunately, he became quite sick. But it helped me understand that this was really a frightening disease, or it was a disease where we didn't know that much at the time.
Correct.
And I wanted to do something about it. It felt like it was important. It felt like it needed people to pay attention. So I had the very good fortune of, getting involved in the campus with learning more. I had an opportunity to help a course for college students at my college to learn about HIV, both in the US and globally.
Right.
And that I even got to do this course with two famous people. One was a Nobel laureate, David Baltimore, and the other was Harvey Feinberg, who went on to become the dean of the Harvard School of Public Health.
Right.
So the two of them would teach this course, and I was one of the teaching assistants, and I had a lot of real, interest in learning. So I started with that, and then I ended up changing from engineering into medicine, actually because of HIV and my interest in public health.
It actually began to rain like cats and dogs, but we will continue our conversation in this beautiful city of Baltimore with her on her achievements and also on the sense of pride that she has brought to this country. So let's continue this conversation. For me, I mean, of course, one of the key flashpoints of your career remains the fact that your research. So I want to understand what were the highlights of your research all these years when you became part of JHU, and which was the year that became the key point for you where you actually realized and began to realize that yes, I have done something which is a momentous feat for myself.
Yeah, so it's very interesting. I started working actually in India in 2003. The whole reason I came to Johns Hopkins was because there was a project happening in India, and my mentor actually, whose name is Bob Bollinger, he had been invited by the Indian government, the National AIDS Research Institute and National Institute of Virology that are in Pune, to come and do a study with them. And so he had successfully gotten some funding from the National Institutes of Health, and then basically had invited me to come take part of it. So as part of that study, the study was to do a medication called nevirapine, which was given to their babies to block the transmission, because HIV can be transmitted from a pregnant mom to their baby.
So all this was happening in Pune?
This was happening in Pune. It was the first HIV clinical trial that was done in India.
By JHU?
And it was done by JHU. It was the first phase 3 trial for any treatment for HIV.
What was the result of that trial?
And the result of that trial was published in Lancet, and it changed the WHO and Indian government policy. The result was that if you gave a baby 6 weeks of a few drops each day of nevirapine, the baby could be safely breastfed, but but it would block the transmission more than half of the time.
Despite the mother being an HIV positive?
Despite the mom being HIV positive. So it protected breastfeeding.
And that practice still continues?
And that is still WHO guideline, even to this day.
And you were part of that study?
And that I was part of that study.
How amazing, ma'am.
Yeah.
Now I want to shift your focus to the modern day problems which India and the world and the United States battle with, that is COVID. How do you think HIV combined with COVID changed the perception of people that one is a transferable disease or a communicable disease and other is equally potent and a threat to the mankind? Because if HIV was not as life-threatening in the late 2000s when it had been tackled with, COVID actually became much more powerful a disease than even HIV.
Right.
If HIV was a taint, then COVID became a life-threatening disease. I want to understand the two phenomena. How do you look at the COVID versus HIV? What do you think is the difference?
Well, we learned a lot about HIV in a global pandemic, but the difference between HIV and COVID is, COVID is respiratory droplet and, shared air. It's transmitted by, shared air and respiratory droplets. HIV is a sexually transmitted disease. Right. And so their transmission dynamics are very different.
Right.
But what we learned is that we needed collaboration, we needed new science, we needed to have people share their data with each other. We needed pharmaceutical companies to act quickly to develop new treatments. We still don't have a vaccine for HIV, but we very rapidly developed a vaccine for COVID.
So why is that so?
HIV is a very different virus. It has a really good way of hiding from the immune system. And it's very complicated how our immune system responds to the virus. Once you're infected with HIV, it stays in your body.
Right.
Whereas with COVID, once you have infection, your immune system can overcome it and the virus goes away.
Right. So there is no way in near future you think that the breakthrough can still come for HIV, that vaccine may be on the verge of reaching the markets and through the researches?
Well, actually, we've spent a lot of effort, and I am hopeful. And in fact, I think even the technology of the mRNA vaccines are going to help us develop probably some new HIV vaccines.
Right.
We've been trying. we as in the global scientific community has been at it for more than 30 years without any success for HIV, but I think we're turning a corner.
Given the fact that you have worked so closely with the Indian government, of course, that you were part of the pilot project of GHU to tackle HIV for the pregnant mothers passing on to the babies, the possibility, and that you have also worked enormously with the Indian government on other issues as well. Where do you think India today faces the problem as far as the diseases or the healthcare system is concerned vis-a-vis US, or you think that India has done better than the US in COVID?
Well, I think that each country tackled COVID with some similarities and some differences.
Such as?
So I will say, India developed a cheap vaccine, which not only was much more affordable for its population, but it also exported over 1 billion doses to the rest of the world, and especially to countries where low and middle income. That's one. Two, it did an incredible job of vaccinating a very large number of people in a short amount of time. So I think that was impressive. And India, I think that the population wasn't as hesitant to take vaccine. In the United States, we had a lot of people who were very skeptical and remain skeptical about the real power of the vaccine. So we had people who didn't want to get vaccinated, who were like, no, don't get vaccinated. So those were some differences. I think also, both countries developed some real technologies for diagnosis very rapidly, for treatments for the disease. So those were some similarities. Now, both countries have a lot of challenges with their healthcare systems. In the United States, we have state and local systems that do their own thing. They make their policies, and what we call in the South, our red states, had more, more people who didn't believe that COVID was actually a thing.
Right.
And so we call them COVID deniers. And so politics entered in a big way with COVID.
Correct.
I think India, COVID was less political in my mind.
Right.
But it had more challenges because it had a much larger population to address. And it didn't have all the treatments. It didn't have Paxlovid. It didn't have all the antivirals that we knew were going to be effective. So anyway, those are some differences.
So that, Ms. Gupta, begets another question from my side. The fact is that in the US, there was a wider consensus being built upon projecting a one particular brand vaccine, that is Pfizer. And there seemed to be attempt to malign the other vaccines in favor of the Pfizer, which of course several governments have also talked about worldwide. And there were also attempts to sort of prove the fact that Pfizer was much more doable than the other vaccines. So you think that the efficacy at that time, if it was suspect or not, or if it was under question or not, one vaccine against another, why were there attempts made by these pharmaceutical giants to favor one particular brand of vaccine and demean the efforts of the other vaccine?
Well, I'm not aware of specific demeaning, but I do think when you're the lead vaccine, right, the first vaccine to make it to market, you often get the competitive edge. And honestly, the mRNA vaccines, it was the first time that we had used this platform technology, and nobody expected it to be as efficacious as it was. And it's not just Pfizer, we have Moderna as the other company. Both of those produced an mRNA vaccine for the first time.
However, the reports have suggested something otherwise, which is that
but there are other vaccines, and honestly, we needed multiple vaccines because the market and the need was so great. No one company could produce enough vaccine for the entire world.
Pfizer paid or spent $1 million in the media market to ensure that things were in their favor?
Well, I think that all the pharmaceutical companies do a lot of marketing, whether you're conscious or unconscious of it. So I think they probably, like many,
they approach people like you, erudite people like you, who are at the helm of the Department of Infectious Diseases to to bat for their vaccines?
No, we're very careful. We have very strong, very, what we would say, clear guidelines of how we interact with pharmaceutical companies. For that very reason, we have to remain very evidence-based, very informed about all the different products. You know, in the United States, it's what we had. Our market was Pfizer, Johnson & Johnson, and Moderna. Those three companies were dominated. And then later, Novavax came a few years later into our market.
Right.
You know, in India and much of, you know, in China was Sinovac, and in India it was Covishield and Covaxin, and other parts it were other products, right? So each of us were trying to get access to as much possible. And I hear you and what you're saying about different companies having different marketing strategies, but honestly, from an academic point of view, our job was to get as much information, be fact-based, and make it available as soon as we could.
Right. What I also want to understand from you is, now that you have talked about the researches and the breakthroughs, is there any particular breakthrough that you are working today at JHU to give it back something to your own country from where you came, although you were born and raised in the US? Or is it also something that you're working to ensure that the United States is also in the safe hands as far as your own contribution to JHU is concerned, what JHU did to you by making the director of the infectious department diseases?
Yeah, so I'm working quite a bit on tuberculosis. So one thing that's really important to know is that before COVID, since 2014, tuberculosis was the #1 killer in the world, infectious diseases killer. It had surpassed HIV in 2014 as being the most highest burden of infectious disease.
What are the recent statistics that you have?
So there are over 10.6 million cases of TB in the world. India has 26% of all the cases in the world. So to date. So 1 in 4 who has TB lives in India. Now, part of it is that India is 1.4 billion population, but it by far has the largest number of cases. And so for me, with HIV, which is also a risk factor for TB, which is how I got into TB, when I was working in India with pregnant women with HIV, I realized that they were becoming sick with tuberculosis. Did
you also yourself risk getting exposed to TB?
Well, I wore a mask. Even before COVID, I was wearing a mask in the hospital.
You went to India?
Yeah.
During that period?
During that period, yes. And in Pune, when I was working on the study with pregnant women. So we do a lot of tuberculosis work. And Prime Minister Modi has declared he wants to attack TB in a big way. The Indian Council of Medical Research, the Department of Biotechnology, you know, the drug companies, the biotech companies are all trying to make new diagnostics. There's even work to make a new vaccine. And so right now in India, we're working with the Indian government and the NIH, the US government, on TB to come up with new treatments, new vaccines, new diagnostics.
As a curious journalist, I am also intrigued by the fact that how many, on an average, you make visits to India to deal with these subjects as a learned department head that you have been of JHU?
Yeah, so, you know, I'm actually in India pretty much every day because of our virtual world, between WhatsApp and Zoom calls and phone calls and emails. I'm literally working every day in India, but I make physically trips, 3 to 4 trips a year.
Yeah. And I'm also given to believe that you run a specific center, which is known as the Gupta GKII Center, which sort of gives a fillip and boost to the young scholars coming from India as well. Is that so?
Yeah, so we have the Johns Hopkins Gupta Klinsky India Institute, and it is a effort to really have bilateral exchange between faculty, students, staff, to conduct research, to work on training, education.
Conceived until now, how many students have you got the exchange done? Yeah,
so, you know, Hopkins has had partnerships with India for almost 100 years. We set this up during COVID. So you can imagine there weren't many people traveling between the two places during the first.
This was set up during COVID.
This was set up in 2020.
Right.
Before that, we had been working as in many different programs, but there wasn't one central home for the engagement with India.
Right.
So we've just sent 8 students this year to India, and then we've had many, many more virtual exchanges, hundreds.
So I will also come back to the same question which I asked you a while back. Is there also any particular research that you think will be breakthrough from JHU, from your department, that you're investing a lot of money on at the moment?
Yeah, so we're investing a lot on tuberculosis in a big way. We're also working on hepatitis, looking at...
What is it you're looking at?
For TB?
The investment in TB. And
so for TB, we're actually...
And what is our objective and goal?
Yeah, so the objective is to prevent TB. So if somebody is living in the household and let's say your mother or father-in-law got, or mother and father got TB, and you've been exposed, we're working on providing you just 1 month of treatment to protect you so that you don't get TB. That's one.
The co-family member to ensure that
they don't get sick themselves with TB.
So on this note, we wrap up our lovely interview here in Baltimore, just right next to Washington, D.C., with one of the lovely faculties of the Johns Hopkins University. Keep watching the New Indian Show as we continue to bring the tales of Indian diaspora from across the globe. That's about it from here.